right, this is Steve Beekman here, and I have Alicia and Ivy with me here today talking about environmental health. How are you guys doing today?
We're good.
Great.
How are you doing, Steve?
Good, good. Why don't you guys give me a little bit of your background, how long you guys have been here, and kind of what you do for the health department then?
This is Ivy here. I have been with the health department for 7 years now, and my role up in environmental health mostly covers food service inspections, well and septic inspections.
And this is Alicia Sanders. I've been with the health department for 16 years. My role as an environmental specialist, I also do food safety inspections and pool, tattoo inspections, spa inspections, and then we do lead-based paint inspections in Woodbury County. Whenever there's a child that has a high lead level, a venous blood draw has been done and it's been deemed high by the state, we go out and do inspections of the home. In addition, I coordinate a Healthy Homes Coalition.
You guys really do a lot for the health department, just in the environmental division then too. Can you tell us a little bit more about what just environmental health does for public health and for the county here, and how many other counties that you guys serve then too?
Yeah, all of our programs vary a little bit differently in what territories that we cover, but for the food service inspections, we actually cover 11 counties in northwest Iowa. In regards to some of the pool and tattoo inspections, those kind of areas as well. But in regards to our role as environmental specialists here at the health department, it's really public health. So everything falls back to the environment. Whether I'm working on septic inspections, how can we install a system that's going to prevent groundwater contamination that then goes into our aquifer and then gets pulled back up for drinking water? When we look at food safety inspections, it all comes down to how can we work with establishments and educate them to have proper personal hygiene, proper cooking temperatures, an employee health policy, so we can also prevent the illness side so we don't have any illness outbreaks in Woodbury County. And I'll let Alicia cover some of the other programs that her role in public health.
Okay, so I'll just talk briefly about the lead-based paint inspections that we do. As I mentioned, the lead-based paint inspections are done when a child under the age of 6 has had a venous blood lead draw and that has come back high. So what is high is anything above a 20 micrograms per deciliter or 2 venous blood lead draws above 15. And so we go into the homes, and basically our main role when we do our environmental investigations for lead-based paint is to see where and if there is deteriorated lead-based paint, and really how to protect that child from actually not to be lead poisoned anymore. And then also coordinating the Healthy Homes Coalition. We work on a whole bunch of different topics with the group. A big one that's coming up is Radon Action Month for January. So we really try to push our short-term test kits that we sell here at the health department for $7. The radon test kits cost includes the test, the postage, and receiving of results.
So you guys really do cover a lot of things for environmental division then too, and it's not just one or two things. You guys really are doing a lot for public health and serving over 11 counties then too. I know you guys mentioned the food establishment safety inspections then too. Can you tell me a little bit more about that, and what are some things that you guys commonly look for when you're doing your inspections then?
Yeah, when we go into restaurants, once again, our main role is to try to educate before we regulate these establishments. However, I think we have a different perspective from what the consumer looks like or looks for going into a restaurant before they eat. They're always looking at the physical facilities. Is it clean? Is it tidy? But we're looking at what are called foodborne illness risk factors. These are violations that can directly lead to foodborne illness, versus some of the other things where physical facility falls under a good retail practice, and it takes several contributing factors for something bad to happen and then lead to an illness. So once again, things like cooking temperatures, reheating temperatures, cold hold temperatures, proper personal hygiene, cross-contamination. There's several things that we look for during an inspection. I think there's probably over 55 or 56 code violations that they can be marked out of.
Wow, yeah, that's definitely a lot of things that you guys are looking for and helping provide that education on then too. So what are some of the common violations that you see, or some of the common things that you educate the food establishments on, and what do you kind of do to help them and correct those violations as well too?
So I'll just kind of piggyback on what Ivy said. So our main role when we go in to do a food service inspection is to make sure that the public is healthy when they leave that establishment. So what we're looking for are all sorts of different things, but some common things that we see when we do go out and do food safety inspections are date marking. So here in the state of Iowa, we follow the food code, the FDA food code, and we're actually on the 2013 food code that we follow. So every inspector in the state of Iowa, we are trained all the same. We all follow the same rules. So ideally, when you go from one place to another, the inspections should look pretty similar. Now, we're all different people, but inspections should look pretty similar. But some of the common violations that we see is date marking. In the food code, any potentially hazardous food, a TCS food, so that's a time temperature control for food safety food, is required to be date marked once it's held longer than 24 hours. So, and then they have 7 days, the establishment has 7 days to use that food. So that's a big one. A lot of times we see ice chutes. That's a big one that we see. That is a food contact surface. So cleaning of the ice chutes, the ice machines, as well as incorrect hand washing is what we see. So making sure that people know when to wash their hands and using that good personal hygiene practices.
Yep, and I just like to kind of piggyback off that. When we see these things, we're working with the manager or the person in charge to gain this long-term corrective action. We don't want them to fix it the day that we're there at a restaurant. We want them to make sure that it's corrected every day afterwards. So when we come back in, say, 6 months or a year, we've noticed a positive change. We can see that they've worked with their staff, they've trained their staff appropriately to make sure that they've gained that long-term corrective action.
That's really a great measure just for the sustainability piece of everything. Is it's not just the one day establishment that happens. It's something that's happening more long term, and people are coming in there different times of the day and different times of the year. So and we are very fortunate to have excellent environmental staff and excellent food establishments here too that very, very great to work with, I know too. So that is a very good thing to have. So I know now it's getting into the holiday season here then too, and as people are preparing meals for family or starting to go out to restaurants then too, what are some things, just good little reminders or tips for people to be mindful of as they're making these meals and going out to restaurants with families?
Yeah, definitely. I think this is a great topic to visit about. We all have potlucks during the holiday seasons, and this is a lot of times where we see an increase in foodborne illness outbreaks. I think what happens is we all come to a large gathering and we bring food and it sits out for extended periods of time as we're all kind of grazing throughout the day. So once again, it all comes down to we need to keep hot foods hot, we need to keep cold foods cold to be able to kind of limit that microbial growth, so that and you look at it in terms of the more if bacteria grows at room temperature, the more bacteria you have, the more likely we are to get sick. So making sure hot foods are hot, cold foods cold. Try to also thaw. I know this is always one we get questions about, turkeys. People think that they can just leave it out on the counter. We want to make sure that we refrigerate that, and you're going to have to plan ahead. So when you have a turkey that's several pounds, you're going to have to plan ahead, figure out how many pounds you have, to figure out how many days prior you need to put that in the refrigerator. And then obviously making sure everyone uses a food thermometer to ensure proper cooking temperatures so your turkey is fully cooked.
Just one more thing to add is if you are going to a family gathering or whatever it may be, and if you have been ill, we would highly encourage you to stay home because that is one big issue that we have seen are ill people either going into work and they shouldn't be going into work. They actually are specific symptoms that they have to be excluded from work. But in addition, protect your family members and try to stay home. And if you absolutely can't stay home, for instance, if it's at your home, see if somebody else can make the food and prep that for you so you don't have a risk of getting others sick.
Yeah, and that's always a great reminder because on our other podcast before, Heidi mentioned that too. Is just try not to be that superhero where a lot of people say, "Oh, it's fine, I can go into work and no big deal," but you're really helping other people as well too, and keeping other people healthy and safe too, instead of spreading everything out too. So that's really great to be able to share that information, especially with the holiday season coming up here then too. Is there any additional information you guys like to share from the health department?
For us, we're always willing to take questions, so if anyone has any questions in regards to what we do in environmental health, you can always give us a call here at the health department.
Awesome. Well, thank you guys so much for your time today too, and I really appreciate you sharing a little bit more about what you guys do in environmental health. Thank you guys so much.
Thanks, Steve.
Thanks, Steve.